But I wasn't given the choice of where to have my treatment. I wasn't given the choice of medication. It was just, you take this and see how you go on. I was never given a holistic needs assessment. I wish I had have done, because I now access acupuncture for the side effects I've got on the medication I'm taking. But I have to go all the way to the Christie for that. I would love it if I could go to a local hospital. And I think the idea of like 4 months after your treatment, you then have this meeting with your clinicians and they say, we can offer you this, we can offer you this and this. Your mind is more able to cope with that information, because at first you get so much leaflets and information. It's just way too much information, because you're trying to deal with the fact that you've got cancer, how you're going to get through it, how you're going to survive it, how you're going to support your family financially, how you're going to pay your mortgage and your bills. There's all that to worry about too.
And patients were telling us that in actual fact they were repeating their story constantly, and they would often say when you arrived and you'd say, tell me a little bit about how you got to this place. Don't you know? Hasn't someone told you?
The district nurses at Victoria Mill work alongside the Macmillan nurses, so they all talk to each other. Now this was a revelation, that I'm not used to medical people talking to each other.
We have this meeting at 12 o'clock daily. It allows us to come in and speak face to face, bounce ideas around as a team, because we're all professionals, we all got our own knowledge and we can problem solve in one room. It allows that, and that wasn't there before.
The daily handover has made us really effective. It's opened lines of communications that, even though they were there beforehand, it was that we were chasing people to try and communicate with them. So the fact that we have the district nurses at the meeting, the dietitians, the physiotherapist, the speech therapist, the CNSs, our assistant practitioners, we have the full range of people that are supporting our palliative care patients.
It was a very sort of intense meeting. Everybody was listening and they were all putting in their contribution at the right time and at the right pitch. And it was only afterwards that I realised that everybody there was caring for me.
I think if you know that the surgery's signed up to the locally commissioned service, although you might not understand, you won't think of it in those terms, but if a patient knows that the surgery is positive about cancer, has a positive attitude and is there for you, you're going to feel a lot more confident in approaching them and feeling that you're getting good advice. Because if you're going to the surgery, for example, saying to have, you need some blood taken, and people don't know, for example, that you can't have your blood taken from your arm with lymphedema in it, you start not to trust the surgery because you're thinking, surely they should know that. So you want people that understand all aspects of the cancer, which I know is a massive, massive ask, but that's why there's so much training and education.
I've been diagnosed with cancer at the very, very early stages, so I'm really grateful that I went for this lung check. I went to the scanner on the precinct on the Tuesday. It was about 9:30 in the morning. And I wasn't there long, I was there about 20 minutes. I was notified by Wythenshawe Hospital with an appointment for the Tuesday. So within a week, I went for a lung health check, and I was then given an appointment at Wythenshawe Hospital within the week. So I think the timescale was absolutely terrific. I hope there's more of these scans about for other people to get the benefit that I've got. And they're definitely nothing to be scared about. You lay on your back with your hands behind your head, and you don't go in and out. All it is a donut that circulates just round and round. You don't actually bodily, physically move in any way. You just lay there. A lot of people have got the wrong idea, thinking that you're going to go in a machine. And some people think they'll never come out, but it's nothing like that. I'm not living in fear thinking, have I got cancer? Because now I know I've got it. And hopefully, because of that lung health check, I'm going to be living for years.